India overnight has now reported a 41% rise in daily COVID-19 cases. Maharashtra once again is recording a high number of fresh COVID cases. The positivity rate has increased substantially in 6 districts. While the cases rise, the administration is pushing the booster dose drive. So far, over 29 lakh people have been administered the precautionary dose. But despite the government earlier planning to have mandatory masking, it doesn't seem to be working on the ground. Is Maharashtra heading for a 4th wave, as some are suggesting? That's what is the big question. Should there be fresh curbs, mandatory masking now? Joining me now is Dr. Rahul Pandit, Maharashtra's COVID-19 task force member. Appreciate your joining us, Dr. Pandit. How seriously are you seeing this? Are we heading, as some are saying, into a potential 4th wave?
Good evening, Rajdeep. I think it's a play of words, if I could say, whether you call it 4th wave or you call it rapidly rising cases. There is no doubt about it that the cases have, as the graph is shown on the screen right now, the cases have increased indeed quite rapidly in the last 7 days. What we need to look at in the post-Omicron era, and I've been repeatedly saying this, is yes, test positivity rate is one way of looking at it, but the better way of looking at it would be, are we actually seeing patients who are requiring hospitalization? Are we actually seeing patients requiring oxygen or ICU beds? Fortunately, none of that is at the moment seen on the ground. For example, my hospital, I have only one COVID patient currently. Most hospitals in the city are not seeing a large number of COVID patients. And even the tally, if you look at it, majority of them are asymptomatic or mildly symptomatic. As the testing increased yesterday in Maharashtra, in Mumbai specifically, we did around 19,000 tests, as opposed to an average of around 7,500–8,000 tests which we were doing for the last so many weeks. The numbers have obviously increased. That means that at the background, there were a lot of patients who were positive, probably, but were not having symptoms. And then as we collected the contacts and we started testing them, we are having higher numbers come across, which is good because we can isolate them, but it doesn't actually reflect the picture on the ground in terms of hospitalizations.
So what you are saying is hospitalizations are low. You are saying most of the cases that are coming are asymptomatic. Therefore, it would be premature in any form to call it a 4th wave. Most of these remain Omicron. There is no new variant out there. At best, there is a sub-variant. Yes. Am I correct?
Absolutely correct. The last genome sequencing reports, whichever have come in the last few weeks, they have shown either BA1, BA2 or the BA4, BA5 subvariant, which you rightly said. And all of them have behaved more or less in a similar fashion with mild upper respiratory tract symptoms and some fever. So, and that is also very short-lived illness. Few days and patients are getting better on their own.
The reason, of course, that people are worried is that a few days ago, the Maharashtra government seemed to suggest that masking would be once again mandatory. Now the government seems to not be very clear about, or certainly not enforcing it on the ground. Are you saying that there is no reason for masking in public, to make mandatory masking in public once again? Is it necessary to have mandatory masking in public once again or not?
So the task force has always said, even when the numbers were low, that in indoor spaces where the air ventilation is poor, where the air circulation is poor, like you are in an auditorium or you're in an office space, you should be wearing a mask, which would help you as a health habit. We've always maintained that you make a health habit. I've said this on national TV before, I'll repeat it again. Just like when we cross the road, we look on our right, we look on our left for our own safety, and then we cross the road. And government has not made that mandatory. Similarly, mask indoors, in the indoor spaces, should not be a mandatory thing, but should be a voluntary health habit. Whether the government wishes to enforce that as a compulsory thing or not, it's an administrative decision which government can take. But from my point of view as a doctor, I think it should remain as a health habit, because COVID has not gone anywhere. It should just come automatically to us, just as a natural thing to put on as soon as we enter indoors where the air ventilation starts becoming poor.
Are you asking for any other precautions beyond that at the moment, in terms of social distancing, in terms of maybe once again reviewing some of the opening up of swimming pools, of commuter trains, buses? Any change at all? Or is the general feeling now that this is effectively slowly becoming almost like an epidemic? So at best people will get mild infections, take the odd tablet and move on after 3 or 4 days of fever.
So we need to keep an eye on how these cases which have suddenly increased in the last 7 days actually show up in the next 7 days, because we know that if the symptoms have to worsen, they worsen in the second week, not in the first week. That's the first thing. But more importantly, the logic should be that we should be learning to live with COVID. Our day-to-day activities should not be hampered. If I would say that in Mumbai you should do a strict social distancing, it would not be practically possible. People would not be able to step out of their houses. So I think what is best is that you actually wear a mask whenever you have crowded congregations or indoor spaces. You try and do as much as you can for your own safety, but continue with your day-to-day activity with full caution and vigilance. Right.
So we are not very quickly going back to what we were in January when the Omicron wave struck, right? We believe that this is not a fourth wave.
At the moment, we need to see how things pan up over the next week or so. That's what we actually have said, that we will review the situation on a day-to-day basis and take up a call.
Okay. Dr. Pandit, as always, appreciate your joining us and sort of informing our viewers. Good to have doctors who are so clear with their thoughts. Thanks very much, Dr. Pandit from the Maharashtra COVID Task Force, joining me.